Okay, guys, for another episode, come to our end. And I had this left arm pain for like 2 months now, or over 2 months. And then I went to a neuro doctor. My neuro doctor recommended me to have this. Okay, so we are back, and like I said, my doctor recommended me to have this procedure to know what's going on with my left arm. And if you have a pinching little pain from all over the arm, or you have a hard time lifting your arm, or like you feel that your arm is getting weaker compared to the right arm, usually the doctor wants to have a nerve test, or it's called electromyography, to test if if your electrical impulses are all okay. Okay, so I'm in my break room, and going back to the procedure. I'm just gonna give you some ideas and what to expect if you're gonna have that. So first, the staff who is trained to do that one, because it's gonna be done by that staff and a doctor. It's consists of two parts, and the first one is from the staff. The staff who is trained to do the nerve test is gonna start with your history, if you have any hypertension or other health issues that he needs to check, before he can do the nerve test. And then the second one is that he's gonna be cleaning your arm. So the nerve test is kind of like. Sure about that one. So the nerve test is.
I didn't understand. Oh, Sarah.
So the nerve test is that he's gonna place a wire on your arm using an electrode. It's like doing the EKG, but it's just placed in the hands. So he's gonna start cleaning your hands. He actually used a cream with some kind of grainy materials. The purpose of that is to take out the dead skins, also to take out the moisture oil in your hands, so that when he placed the electrodes, it can read well. So he was putting it in my hand here, some parts of my hand here, here, and you can see it in my picture. I'm gonna place it here, and then when he's done with the cleaning, then he's gonna place the electrodes, and he's gonna start putting some electricity. So he's gonna start with a small. How do I say it? Like it's a low dose. I don't know. It's a low voltage, something like that. And what it's gonna do is that, since your hand has a electrode here, right? There's actually a handheld he's gonna use, and has two iron in it. He's gonna put it in a spot, and then your arm will be like doing this, and you'll be doing like. Like demo, like. But anyway, yeah, that's gonna be he's gonna be doing to check if you have a good reflex, or if your nerve is still functioning. And I'm just gonna be honest with you, it's not, it's not comfortable. So when I got the first left arm done, I was thinking that's done, but he has to do it on the right arm too. They're gonna compare, because there's actually a reading. That's the electric, thing. He doesn't get a good reading, so you have to do it multiple times. And no, that's the way it is. It's not a good experience actually, but you have to do it. It's part of the test. And so when he compares the reading, then he's gonna compare the left arm and the right arm if there's a difference. There's actually a normal range, and then there's also like a delay that they're gonna check. So that's why they have to do it on both arms. And then when he's done with it, the second part will take place with your neuro doctor. So my neuro doctor was called, and when I said the first one is kind of like uncomfortable, the second one is painful. So I have to be honest. because he's gonna put a needle in your arm. So he's gonna be keeping the electrodes in your arm, but then he's gonna poke your arm. For example, like one needle here, and then he's gonna instruct you to move your finger or push his finger, something like that, if there's strength. So, and this is not just one. I think that this one here is kind of like painful when I put the needle there. The instruction was when I was starting it. He said, I mean the staff was telling me that it's kind of like acupuncture. Acupuncture is that really thin needle, but it's really a big needle, unfortunately. So he poked me in a lot of places here in the left arm and then also the right arm. And I actually have some, dark portion in front of the needle, and it's still here, unfortunately. So yeah, so that's gonna be the thing that you're gonna be expecting when you're gonna have the nerve test. It's a science, and it has to be, supported. If they have to do a diagnosis, they have to get all the labs that they have to do. After the procedure, I was actually sad about it because I was hopeless. I feel like I was tortured and I'm paying them. But, that's the way it is. So, I hope you don't have any issues with your nerves so that you don't have to deal with this procedure. But, this is gonna be one of the things that I will just add it to my nursing playlist, and hopefully I can give you some ideas. If you're gonna be having this procedure, just prepare yourself. You're not allowed to wear any lotions, or I think the other one is okay, but you're advised not to wear any creams in your body. You can eat. You're not be allowed to eat, but you can eat. The only thing is that you're not allowed to have some perfume or lotions or whatever that is applied to your skin, because they want to read the nerve reading, So, yep, that's gonna be it for now. Thank you much for watching, and I hope I can give you some topics that you're really interested in. Bye-bye.